my name's Kayla, and today we're going to do the musculoskeletal assessment. First, what I want you to do is just stand up, and we're going to look at the body as she was sitting down. Everything was symmetrical. Standing up, we look at the elbows, they're even, the hands, the knees, the shoulders, her spine. It seems to be in a line. Now if you could walk to the end of the bed there, turn around, and go back and sit. Now you see her gait is normal, her gluteal folds were even and symmetrical. Things we look for there was lordosis, kyphosis, didn't see any of that in her spine. You want to make sure all extremities and body parts are symmetrical, which they were. No gross deformities, no enlargements, contour look good. With the skin, first thing we're going to do is just look over the muscles and joints, note any swelling or masses. We'll start with the hands. Check all the joints. I don't feel any masses, don't see any swelling. The temperature and color is the same on both hands. She has all 10 fingers. They're complete. She's not missing any parts of her digits. The sizes are even. They're symmetrical. The dominant side may be a little bit bigger. I don't see any spasms or twitching from head to toe. Next thing we're going to do is I want you to fully hold out your hands, flex down, flex up, and open fingers, close fingers. Alright, and then I want you to pull up. Same thing on that side. Push down. Push down. The strength is even on both sides. Same thing with the wrist. If you can flex down, flex up with your wrist. And then same thing. Push up. Push down. Push down. Pull up. Alright. And any pain when you spread your fingers, close them together?
No.
Alright, and then can you grip two of my fingers on that side? Strength was even on both. Next we're going to do is inspect the elbows. You can just start with them straight out. Alright, and then that one. So both are symmetrical, even. I don't see or feel any swelling. And then next, what we want to palpate is the ulna, the alcanine process, and the medial and lateral parts of the humerus. Any pain?
No. I
don't feel any bogginess, no nodules, no tenderness. Alright, same thing if you can flex up and extend down on both. Alright, and now I'll apply pressure and flex up. Alright, strength is even on both sides. Next we're going to do is check your range of motion. If you fully extend and flex, it should be 160 degrees with the elbow flex at the right angle. If you want to rotate the palm of your hand down and up. And next we're going to check is the shoulder. As you see, both are evenly aligned. And we're going to palpate the sternobaccular joint and the biceps grooves, and you tell me if there's any tenderness. I'm back here?
No.
Okay. Now, if you could shrug your shoulders up and down. Alright, once you did that, it was symmetrical. Raise both arms forward. Now up over your head. And the flexion there should be 180 degrees. And now both arms behind your back. And the hyperextension there should be about 50 degrees. Any pain when you did that?
No.
Alright, lift both arms laterally and then up above your head. And the shoulder abduction should be about 180 degrees. And then both down should be, abduction should be 50 degrees. Place both arms behind your hips with your elbows out. And the normal rotation there should be 90 degrees, which it is. And then both of your arms with your elbows sticking out behind your head. And then external rotation should be 90 degrees, which it is. Alright, and then I want to apply pressure and want you to shrug your shoulders again. Alright, and the strength is evenly on both sides there. And next we're going to do is your temporomandibular joint, which is your jawbone. I'm going to first locate by placing my fingers, and then we'll palpate. And the things, as I do this, I want you to open and close your mouth. One more time. Alright. I didn't feel any crepitus. There was no popping or clicking. With her opening and closing her mouth, there should be 3 to 6 centimeters between the upper and lower teeth, the jawbone, which there is. Can you move your jaw side by side? Any pain there? Mm-hmm. Alright, it should move 1 to 2 centimeters in each direction, which it did. Next, I'm going to do the same thing and have you open your mouth. I'm just going to apply. Okay, open your mouth. Now open your mouth. Alright. Any pain when you did that? No. Alright, next we're going to check is your cervical spine. If you want to just turn some, we'll just inspect the alignment, which is straight. There's small curvature in the lower, which is normal. And then I want to palpate down the cervical spine. Alright, and then off to the side. And then both sides. And I want to percuss the lower, and you tell me if there's any pain. Any pain with that? No. Alright. Alright. Next we're going to check the range of motion. If you can move your chin to your chest. And that should flex about 45 degrees, and it does. Same thing if you go back. Any pain when you do that? No. Alright, and then have your ears touch your shoulder on both sides. And that should be about 40 degrees laterally, which it is. And then kind of rotate from side to side. Alright. And then kind of turn your head toward my hand. Same thing this way. Any pain? No. And the strength was equal on both sides. Next we're going to do the thoracic and lumbar. If you want to go ahead and stand up, and you can face there. There's no abnormal curvature. I don't feel any nodules. Alright, if you can bend over and touch your toes. Alright, the flex should be 75 to 90 degrees, which it is. And then bend back the opposite way as far as you can extend. And that should be about 30 degrees. Alright, and then kind of swing your body in a circular motion. Any pain there? No. Okay. You can go ahead and sit down. Next we're going to inspect the hips, the anterior and posterior. We're going to look at the iliac crest and check for symmetrical. As she's sitting, her hips do seem to be symmetrical. Her knees are matching up in a line. I'm going to ask you to stand up again. Alright. And I'm just going to check the iliac crest here. And it does seem to be symmetrical on both sides. Alright, and then I'm going to have you raise one leg to your knee, extend. And same on the other side. Alright, and then I'm going to apply pressure as you do it. And same there. Alright, and the strength was even on both sides. Go ahead and apply one leg behind and then one on the other. And that should extend around 30 degrees. And then if you want to go ahead and lay down. Alright, same thing, I'll have you raise your right leg up in the air and down, left leg up in the air and down. Now knee to chest. Alright, I'll apply pressure here. Same on that one. Okay, the strength was even there. And now if you can rotate your leg out and then in on both sides. And then kind of cross, take the right ankle to the left knee and bend. Okay, and then on the other side. Any pain there?
No.
Alright, next we're going to do is just inspect the knees and the popliteal spaces on both. There is some divots on both sides, which is normal. Any pain in your knees?
No.
There's no swelling, no tenderness. The joints feel firm and smooth. There's no bogginess. I don't feel any nodules or crepitus. Okay. Next we'll do your feet and ankles. You can sit down for that one. Alright. And I'm just going to have you take your feet and down to the floor and then up. Alright. Pull up on my hand. And now push down. Okay, the strength was equal on both of those. Alright, and the Achilles tendons are even on both sides. There's no swelling. She does have pulses on both. Alright, can you take your feet and point inward and then outward? Okay. She does have 10 toes. The temperature is even on both sides. The collar is the same. Her toe size is the same. There's no deformities, no redness, tenderness, or swelling. The range of motion when she flexed up should be about 20 degrees and down 35, which it was. Alright, and that's all I have. If you have any questions.